RNA test detects deadly pregnancy disorder. Hi friends, I am Edwin Williams, EJW Science and Research News Podcast with another edition of Research News. Predicting pre-eclampsia. Eclampsia is the onset of seizures or convulsions in a woman with a pre-eclampsia. Pre-eclampsia is a disorder of pregnancy characterized by the onset of high blood pressure and often significant amount of protein in the urine. When it arises, the condition begins after 20 weeks of pregnancy. In severe cases of the disease, there may be red blood cell breakdown, low platelet count, impaired liver function, kidney dysfunction, swelling, shortness of breath due to fluid in the lungs, or visual impairment. It increases the risk of undesirable outcome for both mother and the fetus. If left untreated, it may result in seizures, at which point it is known as eclampsia. Normally, gynecologists detect pre-eclampsia after 20 weeks of pregnancy. Dr. Moufarrej et al. Have designed an RNA test to identify pre-eclampsia at an early stage. Cell-free RNA or cfRNA circulates in blood and can give clues as to what is going on in the body. This can be used to detect disease before symptoms occur. Researchers have analyzed cell-free RNA in pregnant people and have found that it can give early warning signs of a serious and sometimes fatal disorder of pregnancy, pre-eclampsia. Dr. Moufarrej et al. Reports in Nature 689 to 694 pages of 2022. Liquid biopsy or fluid biopsy, which is sampling and analyzing non-solid biological tissues, mainly blood and urine, study generates evidence that supports the present physiological understanding of pre-eclampsia pathogenesis. Early abnormal placentation and systemic endothelial dysfunction presents a reduced placental signal for pre-eclampsia. Also, the platelets and endothelial cells drive changes in cfRNA before 20 weeks of gestation, with mass shift related to bone marrow T cells, B cells, granulocytes and neutrophils, placental interference, and preeclampsia. Liquid biopsies present an opportunity both as research and clinical tool to learn about the pathogenesis of a human disease and as a predictor of maternal health. Study shows that cfRNA measurements can form the basis of a liquid biopsy test which predicts the preeclampsia very early in gestation. Such tests help to discover and manage individuals who are at risk of preeclampsia, complementing recent efforts based on clinical and lab data. Also, the cfRNA measurements reflect who is at risk of specific organ damage, will characterize and stratify the pathogenesis of preeclampsia and thereby meet the objectives for obstetric care. This early testing enables the doctor to treat the pregnant women at a very early stage of pregnancy, thereby completely eliminating the associated risk to the pregnant mother and the growing child in the womb. I have tried to make this very vital information on such a frightening condition of pregnant women and her family in very simple and easy to understand language. Hope this will help pregnant women to overcome their fear and ensuing risk. Please share this with your friends and family and subscribe my channel. Thank you very much. I am